Do you want to be a calm and happy parent? If you have ADHD, you may feel more like a scattered parent. And really, that's kind of what ADHD does. It kind of makes you feel scattered. So if you have children that have ADHD, you may see some of these things in yourself, or you may think, gosh, I was just like that as a kid. Or maybe your husband or somebody else is saying like they were just like that, somebody that's related to your child. So this is because 70% of the time this runs in the family. And so it's very, very common that the parents that I work with have some of the similar things going on in their brains that their kids do. And so this is why I love being a parent coach, because I really believe that if you have ADHD, you must have a coach. It's so important. 50% of the time, people do not just outgrow ADHD. It's present in adulthood. So just like with our kids, if they're not acquiring the skills, we have to teach them those skills. We get a tutor, we get a coach, whatever it is, right? If we want them to have certain skills, we need some extra help to do that. So what I wonder is, if you're trying to help them to acquire these executive functioning skills that I talk about in these videos, who is helping you? That is really, really important. So I want to talk about one of them today, one of these skills that's really important for you to learn, because I want you to have that skill to think about and to practice. And then I want to talk to you about why you must have a coach and a little bit about how I can help you with that. So emotional regulation is really, really important. And it is one of the things that is really difficult if you have ADHD, or like I call the ADHD brain, or differently wired. It's very hard to regulate. For kids, it's very hard for them to regulate their behavior. We see it in that they don't really know how loud they're talking. They don't know how close to stand next to people. They certainly don't know how to handle their big emotions, or big emotions. You know, emotions become bigger because they don't have a gauge, right? In adults, we also have to learn emotional regulation. This affects us in our relationships. It affects you in the way that you handle your child's outbursts, you know, all of those things. So the first few years of life is when emotional regulation is, you can tell, like if somebody's going to be able to get through that or not without extra help. So, and we see that all the time with toddlers. They have, you know, these big outbursts. But if you have kids that have some different wiring and they have some problems with emotional regulation, you're going to see tantrums that last a lot longer. It may be more difficult than you saw with your other children. Maybe you were told that you had major tantrums when you were a kid, and it takes somebody knowing how to work through that with a child. It doesn't just go away. And so I think we're seeing more and more people growing up and not having emotional regulation, because I feel like there's less and less teaching for parents on how to establish emotional regulation. And we kind of leave it up to the schools, and that's not really the best place for kids to learn emotional regulation. So it takes practice, right? And so when you are going through something, when you're feeling distraught, or when you're feeling anxious, when your child is having a meltdown and you are going to have a meltdown too, or maybe you're just going to have a meltdown and then your child's going to have a meltdown, whatever's happening, like it's going to take practice, and it takes some self-talk. And so as an adult, you can push through that self-talk piece of it in a way that your kids are going to need some help with, because that's another executive function. But it also helps you move out of the emotional part of your brain into the cognitive part of your brain when you can have positive self-talk. So rather than telling yourself like, oh, you're just being silly, or, you know, I need to stop, you know, why am I acting like this? You know, all of those things. I like to encourage parents to be kind to yourself, to recognize like, okay, this is really hard, and to concentrate about having the calmest brain in the room when your child needs emotional regulation. So in order to do that, you're going to need to be able to tell yourself like, it's okay, this is hard, but I can handle it. I'm going to get through this. I'm going to be calm now, and then later I can have a meltdown if I need to, but right now I'm going to work through this. So it's being able to talk to yourself. You may notice like you have a tightness in your chest, and you may find it really hard to think about something positive. So this is where you might need to practice some of that. It's not affirmations like that nothing's happening or that it's not hard. You're not going to resist the feelings. You're going to move into the feelings and acknowledge, like, I'm feeling really upset right now. I'm really tired, or I'm really angry, or whatever it is. And then that you're going to kind of instruct yourself how you're going to move through it. So one of the ways that I do this with parents when we're doing my 12-week program is we do what's called a Calm Plus 5. And I have you do it with your child. So you're going to, when your child is ready, when they're ready to be calm, they're going to come and sit by you, and you're just going to practice. I like to practice this before there's anything going on so that you know how to do it when there is stuff going on, because I can help you do it with your child, but you've got to know how to get yourself calm first. So during that time when you're waiting for your child to get calm, like you're going to use that positive self-talk, but you're going to also, like, yourself, like, work on getting yourself to calm down. Like, and the way that I think works best is to realize that you don't have to embrace what's happening right now if something is making you upset, but you just have to know that, okay, I'm going to have to get myself calm. So with a lot of adults, like, we know that we need to get up and move and do something. You may need to go, take a quick walk. You may need to go outside and then come back in. You may need to tell your child, like, I need a few minutes, if you can safely do that. But if your child's having a meltdown and then you're trying to get them calm and you're trying to get yourself calm, then you have to kind of find ways to tell your brain how to do that. But emotional regulation, I want you to just understand that if you have ADHD, this is a hard thing, right? Like with kids, it comes out in their behaviors and regulating their behaviors. But with us as adults, it may come out in the things that we blurt out, our yelling, or our thoughts, our emotions come out in a different way than just our behavior. Sometimes in our behaviors too. So recognizing when you kind of feel that tightness, and then what we want to do a lot of times when we're not emotionally regulated is we want to find a way to get like a dopamine hit. So this is where some people may, like, they call it stress eating, right? Or just eating when you're upset, or drinking. Is interesting as people get older, some of their habits that they use to get a dopamine hit are more and more destructive, right? So that's why it's so important to teach kids when they're younger how to have emotions and feel them, and to be able to move on without resisting it, but also without having to have really adverse behavior, because behavior is what gives them the dopamine hit. But then as they get older, they may replace that behavior with other things like smoking, drinking, drugs, things like that. So we're working on that. We're also not just diverting it, right? Like, it's not just distracting yourself, like, distracting yourself with your phone or with something else to get yourself calm. It's like taking that moment, feeling it, acknowledging it, and then allowing yourself to get calm. Okay, so having said all that, I know it's a lot harder to do than me just saying it, right? And this is why I really feel like parents must get a coach. I think that if you have a child with ADHD, you should have a coach. But if you have ADHD, you need a coach, and not just therapy. So therapy is designed to work because you meet once a week, you talk about things, and I'm not saying that this has to replace that, but coaching is more intensive than that. It's a couple of times a week. It's having contact almost every day with your coach to stay on track, to work on new skills, to build new habits. The coach approach is, to train you, to lead, to nag you if we have to cheer you on, to give you those positive affirmations. But it's also collaborative, because with the coach, you're going to set up goals, right? These are things that you want to obtain. What is your goal as a parent? Do you want to stop yelling? Do you want to you want to be able to help your child to be able to regulate? And the goal can be centered around something with your parenting or something even that your kid is doing, because I can help you to know how to do that. So the coaching program that I offer is 12 weeks long, and every single day, the first 30 days, you get a really short video, which is all you need with coaching, is just a short video, some kind of input saying this is day one, here's what we're working on. But then you get a weekly video that lines out again what the goal is for that week, what we're working on, and you get 2 calls with me. And that's because that's what's transformational, right? Like that's what's going to get you from where you are to where you want to be. If you wanted to be an Olympic swimmer and you already had good swimming skills, then you need a coach to still help you to refine those skills. So typically I'm working with parents that are already good parents. You may not know it because maybe nobody's told you. Maybe you go to bed every night feeling like you're failing or that you're not doing a good job or that you can't do it. But I'm here to tell you that most of the parents that I work with, I would probably say all of them, are really good parents. They just want to be able to do better. If you're a parent with ADHD and you feel like you're scattered, you want to be calm and you want to be happy, then you are going to need some extra help, because it's not your fault, but you've got some different things going on with your executive functioning that are making it harder for you to do maybe even what the kids' teachers are telling you or the counselors. Like maybe getting through homework is super hard because it's super hard for you as well to help with that structure and to do that. So the coach approach is collaborative, it's affirmative, it's about setting goals, learning how to regulate yourself, learning how to help regulate your kids. And I think it is the difference between, well, I just think it's about winning the game, right? Not just getting through it, not just playing to not lose, but it really helps you to feel like you're winning as a parent. And who doesn't need that? I mean, how many times have you gone to bed at night and just felt like, oh my gosh, like I didn't even do all the things I wanted to do. I don't even know if I connected with this child. And you're just going to bed feeling maybe even more scattered. So again, if you want to be calm, you want to be happy, if you feel like you're a scattered parent, if you're a parent that has ADHD yourself, then for sure you're going to want to have somebody like me in your corner helping you every day, every couple of days. You have access, to text to get help in the moment, which is when things are happening. That's when you need the most help. And if you have kids that have ADHD or challenges due to trauma, other diagnosis going on, you still, you're a hero and you need some help to keep that going, right? You need your somebody in your corner to help you to do all of that. So that's what I do here. I want you to practice some of those regulation techniques that I shared with you about the self-talk and getting yourself calm, and then consider what it would do to you and your parenting if you to take it up to another level and have a coach. Contact me at parentingchallengingkids.com on the Let's Get Started page. And on that page, you can set up a call with me, and we get 30 minutes of free coaching, and you can kind of try it out and see if you like my approach, if we're a good fit or not. If not, I might have some recommendations for something that might work better for you. I will talk to you later. Look for resources in the bottom of this description, and we'll talk to you later.